There was frustration today as the health commissioner said he did not have the answers to a lot of the key questions. But there was also a push to fix the problems with this rollout and make sure all residents have access to the vaccine.
I first want to acknowledge the mistake, apologize to the city of Philadelphia, apologize to anybody who feels that they were wrong by this, and I'm sure there are many.
Dr. Thomas Farley today in the center of your screen and at the center of a controversy over the city's relationship with Philly fighting COVID, a startup entrusted with vaccinating Philadelphians. Council members today probing for how the relationship between the city, the group, and its 22-year-old CEO started.
So how did Andre Dorshin become a member of this advisory committee?
That is also a very good question to which I would like the answer to. I don't know the answer.
Dr. Farley repeatedly saying he did not have answers to some of the key questions about how the group was vetted.
Who looked at it? Who thought this was a good idea? What did they see in this application? Those are the kind of questions I think that we're all looking for here. Looking to have answers.
And I think that those are excellent questions. I want to know the answer to the questions myself.
The commissioner did today bring data on how long it could take for all Philadelphians to get vaccinated. Dr. Farley saying at the current rate, if the city's weekly shipment of vaccines doesn't increase, it will be October till 2/3 of the city's adult residents get the vaccine, March 2022 until 100% are vaccinated. At the hearing today, council members also pressing the commissioner on how the city will reach vulnerable communities and make sure distribution of the vaccine is equitable.
Black and brown Philadelphians, vulnerable communities, have been less able to access testing. They've had less of an option to stay at home and self-quarantine. They've been more likely to die from COVID-19 as compared to white counterparts.
The people Philly fighting COVID was supposed to be vaccinating were unaffiliated healthcare workers, including home health aides.
I want to make it clear that this is a group of individuals serving vulnerable individuals who need to be tracked. They are 1A. Many of the people that I've spoken to have no clue about how to reach the city health department. It needs to change. It's one of the fallouts of the Philly fighting COVID fiasco that must be dealt with.
While Dr. Farley was in the hot seat today, the chair of the committee starting out the hearing calling out Mayor Jim Kenney, who was invited but declined to attend.
The responsibility for this fiasco falls squarely on the mayor's shoulders as the city's chief executive.
The mayor's office referring NBC10 to the letter Mayor Kenney sent regarding the hearing, saying he shares frustration and disappointment regarding Philly fighting COVID and wants questions answered too, but that he does not have any unique knowledge that would help. As for Dr. Farley's future with the health department, he said today he still feels that he can contribute and that there is more work to do. But he said that if at any time Mayor Kenney feels that he is not the right one for the job, Mayor Kenney can ask Dr. Farley to resign. And Dr. Farley said he would be happy to do so. I'm Lauren Mayk, NBC10 News.